All right, good afternoon, and thank you for joining us for today's briefing on this new platform. So as you know, once you have a question, just send a text or signal that you want to ask me a question. Stephanie will then tell me who it is. I will call on you, and I will be able to hear you. As a reminder, please mute your microphones now. Starting with Libya, in a statement we issued yesterday, the Secretary General strongly condemned the heavy shelling of Al-Qadra General Hospital in Tripoli. He also condemned the continued attacks on medical personnel, hospitals, and medical facilities, particularly at a time where they're critical to prevent the spread of the COVID-19 pandemic. The Secretary General reminds all parties that medical personnel, hospitals, and facilities are protected under international humanitarian law, and that attacks on them may constitute a war crime. The Secretary General reiterates his call for a global ceasefire and a humanitarian pause in Libya in order to save lives and enable the Libyan authorities and their partners to devote all their energies to stopping the spread of the COVID-19 virus. Staying in Africa, the World Health Organization says the confirmed numbers of COVID-19s on the continent has risen to more than 10,000, with more than 500 recorded deaths. While the virus was slow to reach the continent compared to other parts of the world, infections have grown exponentially in recent weeks and are continuing to spread. Reaching the continent through travelers returning from other hotspots, Africa's first COVID-19 case was recorded in Egypt on February 14th. Since then, a total of 52 countries have reported cases. The World Health Organization is calling for a decentralized response, which is tailored to the local context. Communities need to be empowered, and provincial and district levels of government need to ensure that they have the resource and expertise to respond to the outbreaks locally. WHO is working with governments across Africa to scale up their capacities in critical response areas such as coordination, surveillance, isolation, case management, and contact tracing, as well as infection prevention and control risk and communication, as well as community engagement, as well, and including laboratory capacity. Turning to Asia, our colleagues there at the UN Economic and Social Commission for Asia and the Pacific say that COVID-19 is having far-reaching economic and social consequences for the region, with strong cross-border spillover effects through trade, tourism, and financial linkages. A new report highlighting the immediate risk to the region's economic outlook posed by the pandemic, deepening the economic slowdown that was already underway. In a statement issued today, the head of Unicef, Henrietta Fore, said the COVID-19 virus is generating an unprecedented global economic crisis, with economic destruction cruelly and unequally distributed. For the world's poorest country, the financial fallout caused by the pandemic, combined with debilitating debt service obligations, are hampering their ability to prevent further transmission and protect citizens, said Ms. Fore. She noted that for the families within those countries with widespread loss of income and limited access to food in environments where social distancing is impossible, soap and water for hand washing is a luxury, and quality health services non-existent, the situation is already dire and only going to get worse. While children are already spared the immediate health consequences of the pandemic, they will suffer the economic destruction left in its wake. This Ms. Fore cautioned. More than 200 million children live in debt-distressed countries and those at high risk of debt distress. Her full statement is online. Turning to the situation in Venezuela, the UN resident coordinator and humanitarian coordinator for the country, Prita Groman, said that the first shipment of 90 tons of UN life-saving supplies is scheduled to arrive today in Venezuela to support the COVID-19 response. The shipment includes 28,000 personal protective equipment kits for healthcare workers on the front lines, as well as oxygen concentrators, pediatric beds, water quality control products, hygiene kits, Those are among the items being shipped in. The supplies were financed by the international donor community, the UN Central's Emergency Response Fund, and UN agencies. Today's flight was also arranged by Unicef. The supplies will be made available to healthcare centers for the most vulnerable people through partners of the Pan American Health Organization, UNICEF, and the UN Population Fund. In support of national efforts to respond to the pandemic, the UN and our humanitarian partners are appealing for $61 million to scale up the response under the COVID-19 Prevention and Response Plan for Venezuela. The plan focuses on strengthening the capacity of the health system to quickly identify and treat COVID-19 patients, supply water, hygiene, sanitation in prioritized hospital and communities, and provide timely and trustworthy information to the public to prevent the spread of the virus. The plan also seeks to ensure other critical humanitarian programs can continue, including provisions of food, nutrition, protection, and education, among others. The UN is calling for solidarity, access, and increased funding to help combat the pandemic and save lives, while urging donors to sustain the existing humanitarian response plan. As of yesterday, April 7th, 166 COVID-19s were confirmed in Venezuela and 7 deaths were reported. Turning to Nigeria, the UN there is supporting the government-led effort in curbing the spread of the virus, where we are today donating 3 ambulances to Lagos State, home to about 21 million people. Other essential preventive and testing and treatment equipment has also been procured and is expected to arrive in the country in the coming days. Staying in Africa and turning to Zimbabwe, where the severe climate and recession-induced hunger crisis is deepening the COVID-19 crisis. The World Food Programme said today they are urgently calling for $130 million through August to help millions of the most vulnerable people in the country. A recent nationwide assessment found that the number of acutely insecure Zimbabweans has risen to 4.3 million from 3.8 million at the end of last year. WFP's director in the country, Eddie Rose, said that with the most Zimbabweans already struggling to put food on the table, the COVID-19 pandemic risks even wider and deeper desperation. The total number of food insecure people in Zimbabwe is now at 7.7 million, which is more than half of the country's population. And an update on some of our operations in Latin America, where the UN Humanitarian Response Depot, which is located in Panama, the depot managed by WFP, is the primary regional logistics hub responding to COVID-19 in Latin America and the Caribbean. A COVID-19 special unit was created and has planned to double the number of staff, including pharmacists, to manage the cold warehouse where medication will be stored. The depot has already airlifted more than 8 tons of supplies to 24 countries on behalf of the Pan American Health Organization and WHO, including some COVID-19 kits. Several commercial flights canceled around the world. The humanitarian depot now plays an important role in pandemic response. The depot manager in Panama said they are trying to ensure that humanitarian cargo reaches its destination within 48 hours of an order being placed. And a note from the UN Economic Commission for Europe, which is reiterating its call to all countries to facilitate the cross-border flow of goods, particularly food, to the maximum extent possible during the ongoing pandemic, and to make full use of existing trade facilitation standards. The Commission is sharing online information on the pandemic's impact on Europe's food, agricultural sector, and global food supply chains. And a note from Spain, where our colleagues at the local chapter of UNICEF says they've delivered a first batch of medical supplies to the Spanish health authorities to support the fight against the pandemic. The shipment includes hand sanitizers and gloves, and more supplies are expected in the coming days, including masks, gloves, detection kits, and personal protective equipment. The donation is part of UNICEF's global COVID-19 response in collaboration with the World Health Organization and done through the COVID-19 Solidarity Response Fund, currently being promoted by the United Nations Foundation. And the UNICEF And the Religion for Peace Coalition yesterday launched the Global Multi-Religious Faith in Action COVID-19 initiative. The aim is to raise awareness of the impacts of the virus pandemic on the world's youngest citizens. The initiative reflects a unique and critical role played by religious leaders and actors in influencing values, attitudes, and actions that affect development and well-being for the world's children. The initiative is coordinated by the Global Partnership on Faith and Positive Change for Children, Families, and Communities, which involves religions for peace's interreligious councils, including senior leaders of the world's religions and spiritual traditions. And lastly, according to a new report issued by the International Labour Organization, the COVID-19 pandemic is expected to wipe out 6.7% of working hours globally in the second quarter of 2020. That's equivalent to 195 million full-time workers. The report highlights some of the worst affected sectors and regions and outline policies to mitigate the crisis. There is more information online. I will now take your questions, but as a reminder, once again, please mute your microphones or this will not be possible. So let's see how we do this. And I will go to Stephanie, who's sending me questions. All right, Edie, if you want to go ahead and ask the question, and I will hope to hear you. Go ahead.
Thank you very much, Steph. I have two questions. What is the Secretary General's reaction to the OPCW report blaming the Syrian Air Force for a series of chemical attacks in March 2017 on the central town of Latamne? And my second question is a follow-up to President Trump's threat to cut off funding to the World Health Organization. Has the Secretary General spoken to Dr. Tedros, the head of the World Health Organization, and or has he spoken to anyone in the Trump administration about the president's threat to cut the agency's funding?
Sure. Okay, let me start with the OPCW. The Secretary General has taken note of the issuance of the first report by the OPCW, which was submitted to the Executive Council of the OPCW by its Investigation Identification Unit. I think for the questions regarding the content and the conclusions of the first report should be directed to the OPCW. As a matter of principle, it goes without saying, but I will restate it, that the Secretary General reiterates his position that the use of chemical weapons by anyone, anywhere is intolerable, and impunity for their use is equally unacceptable. It is imperative to identify and hold accountable all those who have used chemical weapons. On the issue of WHO and funding, and we've seen reporting and comments made in different parts of the world. I will tell you that the Secretary General has been, of course, in touch with the World Health Organization as well as with the U.S. Authorities. And let me just, if you allow me just a few minutes, I will share with you the Secretary General's thoughts on the very important work of WHO, and that the COVID-19 pandemic is one of the most dangerous challenges this world has faced in our lifetime. It's above all a human crisis with severe health and socio-economic consequences. The World Health Organization, with thousands of its staff, is on the front lines, supporting member states and their societies, especially the most vulnerable among them, with guidance, training, equipment, and concrete life-saving services as they fight the virus. The Secretary General had his chance to witness firsthand the courage and determination of WHO staff when he visited the Democratic Republic of the Congo last year, where WHO staff is working in very precarious conditions, in very dangerous and remote locations as they fight the deadly Ebola virus. And it's been a remarkable success for WHO that no new cases of Ebola have been registered in months. It's the Secretary General's belief that the World Health Organization must be supported, as it is absolutely critical to the world's efforts to win the war against COVID-19. This virus is unprecedented in our lifetime and requires an unprecedented response. Obviously, in such conditions, it's possible that the same facts have had different readings by different entities. Once we finally turn the page on this epidemic, there must be a time to look back fully to understand how such a disease emerged and spread its devastation so quickly across the globe, and how all those involved reacted to the crisis. The lessons learned will be essential to effectively address similar challenges as they may arise in the future. But now is not that time. Now is the time for unity, for the international community to work together in solidarity to stop this virus and its shattering consequences. I will go to Iftikhar now. Iftikhar, if you want to turn on your microphone. Iftikhar Ali. All right, let's try James Bays.
Hello, Steph. Can you hear me?
I can hear you. So nice to hear your voice, James. It's been too long.
Okay, I'd like to ask a question, and if I can, as in the briefing room, be afforded a follow-up question too. My question is about the OPCW report. Given the long and horrible saga of chemical weapons in Syria, this is a very important moment. The UN's chemical weapons body has come up with a conclusion on 3 cases. They say the Assad government was responsible. Will the Secretary General condemn the Assad government for those chemical attacks?
The Secretary General, I mean, first of all, I will say that the report is being done by the OPCW. They are responsible for any questions regarding the report should be directed to them. And I think the OPCW has done very important work by identifying and by with this report. The Secretary General, his position is unchanged, that it is intolerable that anyone, anywhere, use chemical weapons, and impunity for use of these is equally unacceptable. And it's imperative to identify and hold those accountable who have used the chemical weapons. So I think that is my answer.
Follow up,
go ahead,
please.
Go ahead.
You say it's intolerable for anyone to do this, but the OPCW says that the Assad government did it. Will you not condemn the Assad government? And why are you playing this lame game of not taking sides, trying to be equal to both sides? Aren't you leaving one very important side out of this? And that's the Syrian people who have been gassed and over the last 50 years by the Assad regime have been executed and tortured.
I think we are on the front lines with the Syrian people. We have been, our humanitarian colleagues have been there throughout this conflict, trying to support the Syrian people in their daily lives. We have been there since for years, and we will continue to be there. We have been there through conflict in very dangerous conditions. Obviously, the ones who are suffering the most are the people of Syria. And as I said, anyone who uses chemical weapons is to be condemned. Iftikhar, have you been able to join? Okay. Trying to see if there are any more. Dulcie, go ahead. Dulcie Lembach. Pass blue. Go ahead, Dulcie.
Steph, it's Edie. I think some people are having trouble getting on, but they've put questions in chat.
Okay, so let's, I think I see a question from Iftikhar Ali. Does the Secretary General's March 23 global call for a ceasefire also applies to the line of control in the disputed Kashmir region? There is no region in the world in which the Secretary General's call for a global ceasefire does not apply. That is clear. It is a global. Global means global. Dulcie asks, how much does the U.S. owe in peacekeeping? I don't have the figures off the top of my head. I understand they're in the process of paying or have paid quite a big chunk of that, but we can get you those numbers. I don't have them, the numbers with me.
It's Pam Falk. Can we just ask?
Go ahead, Pam.
Thank you. Just on the Coronavirus Security Council closed meeting tomorrow, do you have any teaser or sense of what the Secretary General's message will be? Will that be made public?
The Secretary General has been asked by the Security Council to brief. He will basically give a broad update on the impact of the virus on the UN's operations, political operations, peacekeeping, humanitarian, and so forth. Dulcie was asking about the number of cases in peacekeeping. I don't have that breakdown. I can tell you that as of yesterday evening, there were 175 confirmed cases among UN staff worldwide, 32 in the US, and that's 19 here in the Secretariat. Beichul is asking if we're going to release the Secretary General's statement. The statement will be made in close consultation, so those are traditionally not released. But let's wait till the end of the meeting, and we'll see what we can do. Evelyn asks, how many African countries have been impacted by the coronavirus? From what I've just read, that number, according to the World Health Organization, is 52.
Thank you.
Okay. Any other questions? Ahmed Fati, go ahead. I think, Ahmed, you had a question about WHO, so I've answered that in the statement. Yeah, all the questions on WHO, I've already answered.
Steph, I have a question about the peacekeeping announcement yesterday.
Go ahead.
The peacekeeping announcement had a reaction. There was an immediate reaction from the EU 27 ambassadors. They seemed concerned. They said, of course, they understand the need for suspension of redeployments and but that said, that peacekeeping work has to continue. What is your sense of the level of concern of contributing countries, and should they be concerned? Thanks.
I think everyone is concerned. Everyone is concerned by this crisis. Our colleagues in the Department of Peace Operations and Department of Support are doing their utmost to mitigate the spread of COVID-19 to our peacekeeping missions, with also mitigating the impact on our ability to do work. And that's a principle that applies across the board in the UN. We are all living in a strange new world, and we have to take the best possible precautions so that the UN does not become a vector for the spread of the virus.
Steph, it's Edie. A follow-up on that. Has the Secretary General, has the UN received requests from any troop or police contributing countries to bring their troops or police home because of COVID-19?
I will have to check. I know that the policy put forward had room for exceptions, very strict exceptions, but I will check with our colleagues in peace operations and get back to you. Okay. Any more questions?
Very quick follow-up on the WHO funding cutbacks. You said you stated the Secretary General's comment. Is there any effort to speak with President Trump?
As I said, we are in touch with the U.S. administration at various levels, and we will issue what I've just read as a statement from the Secretary General very shortly. So you'll have the exact words that I've read out. All right. Well,
one more question.
Yes,
Stephane,
go ahead.
there are millions of workers in the Gulf region, foreign workers in Saudi Arabia, Qatar, United Arab Emirates. Those first, they don't have health insurance, and they cannot go back to their homes. And if the situation continues to deteriorate, do you have any idea what could happen to those millions of workers? Because the SG
in every country there are vulnerable population, migrant workers, refugees, undocumented migrant workers are all very vulnerable. What is important is that countries give the same access to healthcare protection and medical facilities to their citizens as well as those vulnerable population. Everyone who lives on these territories should be given the same access to COVID-19 medical facilities, because in order to beat this virus, we're going to have to address individuals regardless of their status. And obviously, those migrant workers are also not only more vulnerable from a health standpoint, they're also much more vulnerable from an economic standpoint. Dulcie was asking for the number of fatalities in the UN system, and there are two, one in the Food and Agriculture Organization and one in WIPO, the World Intellectual Property Organization. All right, any more questions? Well, I'm sad not to see you, but I'm happy to finally hear you, and a big thanks to our technicians who have made this possible. All right, hasta mañana.